Let's address a disappointing finding from intermittent fasting research. In multiple studies, including the one we're analyzing, time-restricted eating failed to improve cholesterol levels. Despite weight loss, despite metabolic changes, despite improved insulin sensitivity in some cases, the lipid profile remained stubbornly unchanged. This tells us something important about cholesterol metabolism and the limits of dietary interventions. Cholesterol regulation is heavily genetic. Your liver produces most of your cholesterol, roughly 70 to 80%. Dietary intake influences this, but not as dramatically as people assume. Some individuals are hyperresponders. Their cholesterol levels rise and fall significantly with dietary changes. Others are hyporesponders. Their levels barely budge regardless of diet. This genetic variation means dietary interventions affect different people differently. The APO genotype is particularly influential. People with certain APO variants, especially APO4, tend to have higher cholesterol levels and show minimal response to dietary interventions. For these individuals, meal timing or even dramatic dietary changes might produce frustratingly small improvements in lipid profiles. They might need pharmacological intervention regardless of perfect dietary adherence. Saturated fat intake probably matters more than meal timing for cholesterol levels. Studies consistently show that reducing saturated fat, particularly from animal sources, can lower LDL cholesterol more effectively than changing when you eat. If your intermittent fasting eating window still includes significant saturated fat, you probably won't see cholesterol improvements regardless of timing. There's also increasing recognition that standard cholesterol panels miss important nuances. LDL cholesterol is an average of particle sizes. You can have the same total LDL but different risk profiles depending on whether those particles are large and fluffy or small and dense. Small dense LDL is more atherogenic, more likely to contribute to arterial plaque. Oxidized LDL is more dangerous than native LDL. Lipoprotein A or Lp(a) is a genetic cholesterol variant that dramatically increases cardiovascular risk and doesn't respond to lifestyle interventions at all. This complexity means that focusing on total cholesterol or even LDL numbers alone is overly simplistic. You can have normal cholesterol but high oxidative stress, high inflammation, and elevated cardiovascular risk. Conversely, some people with moderately elevated cholesterol have excellent cardiovascular health if other risk factors are controlled. The role of HDL cholesterol is more nuanced than previously thought. We used to think HDL was universally protective, the higher the better. Now we know that dysfunctional HDL exists, HDL that's lost its protective capacity and might even be harmful. Simply raising HDL through dietary changes doesn't necessarily improve outcomes if the HDL isn't functioning properly. Triglycerides often respond well to carbohydrate restriction and weight loss, which intermittent fasting might achieve through reduced calorie intake. But again, this is probably about the calorie deficit and carbohydrate reduction, not about meal timing specifically. Someone eating the same low-carb diet across multiple meals would likely see similar triglyceride improvements. For many people with problematic cholesterol profiles, particularly those with familial hypercholesterolemia, dietary interventions alone are insufficient. This is where the evidence for statins becomes relevant. Statins dramatically reduce LDL cholesterol and cardiovascular event risk. The data supporting statin use in high-risk individuals is overwhelming. Yet, there's tremendous resistance to medication, with people hoping dietary changes will be enough. The takeaway here is realistic expectation setting. Intermittent fasting might help with weight loss, might improve some metabolic markers, might make dietary adherence easier for some people. But if you have high cholesterol, particularly if it's genetically driven, you probably need a multifaceted approach including saturated fat reduction, increased fiber intake, regular exercise, possibly plant sterols or omega-3 fatty acids, and realistic consideration of medication if lifestyle changes prove insufficient. Meal timing alone isn't going to solve a cholesterol problem.